Okay, good morning, everyone. My name is Pharmacist Ubunna Ayolwe, and I'm so happy to welcome you all to today's edition of Kenix Care Conversations. I'm so happy because I know today is going to be value-packed. We have a lot of resource persons that are going to be teaching us about how to effectively treat, practically prevent, and ensure that there is no repeat of malaria. I'm sure between January and now, you or someone you know must have come down with malaria at some point. So malaria is not really news to us. But on today's program, we're going to be diving in on how we can effectively treat to ensure that we break the cycle of malaria. Kenix Care Conversations is a platform that is provided by Kenix Pharmacy to bridge the gap between healthcare professionals and patients, right? So that we'll be able to learn, we'll be able to understand, we're able to have deep understanding of certain health conditions. It's an opportunity for you to ask questions. It's an opportunity for us to learn from resource persons, from the experts about these health conditions. So we encourage you to please listen attentively. Please put down your questions. Any question around malaria, we have people that are qualified and explain, and of course, answer your questions regarding to malaria. So I'm welcoming you once again to the program, and I'm happy you are here, and I know you're going to pick one or two things from today's episode. So speaking to us today is Dr. Kehinde Adeniran. This particular episode of Kenix Care Conversation is supported by Lagos State Ministry of Health. So we have Dr. Kehinde Adeniran here. She is a community physician and she has over 18 years of practice and experience. And of course, she is the case management officer of Lagos State Malaria Elimination Program. And of course, she has passion for improving community health outcomes. So you see, this is a very resourceful person. This is the best person who can actually talk to us about how to eliminate malaria. So please pay attention. We also have Dr. Azom from the University of Nigeria and Nsukka. And she has specific area of research on nanonized drug delivery systems for treatment of malaria. So please pay attention. We have the best people on the call today to teach us and for us to ask questions and learn from. So welcome once again. I want to thank Kenix Pharmacy for providing us this avenue. Kenix Pharmacy remains your dedicated partners to optimal health, and they have commitments. We have commitments to providing high quality medications with exceptional pharmaceutical care. So welcome once again. And I'm going to hand over to Dr. Adeniran now to take us on the first part of the presentation. Welcome, Dr. Adeniran.
Hello, good morning. Okay, so I'm set. Can I go on?
Yes, please go on, Dr. Adeniran. Thank you.
Okay. Okay, so I'll be talking about malaria. The very popular malaria we all know about. Understanding the treatment, the prevention, and the control. Next slide, please. Next slide. Okay. Introduction, the global burden, the transmission, the management of the malaria, the prevention, and the control. It's going to be, so Nigeria, we all know that one way or the other, Nigeria government is trying to make efforts in reducing malaria because so far, from World Global Studies, Nigeria has one of the highest burden, if not the highest, 27%. And we know malaria is a public health problem, which they are still trying to tackle. It has really impacted negatively on the economy and it poses cost both the individuals and government, because when you have malaria, you have to pay from your pocket or use the HMO. So one way or the other, you're still spending money. What is malaria now? The picture I put there is the mosquito itself. And we should always remember that it is the female Anopheles mosquito. Infected female Anopheles mosquito. Please, let's not forget, it's the infected one, not just any type of mosquito. There are different species. Plasmodium falciparum is the genus, which we don't really need here. But remember, is the infected female Anopheles mosquito. Next slide. So, as I said earlier, there's been an estimate of 263 million new cases and 597,000 malaria deaths globally in 2023. That is how bad it has been. And World Health has also said that African children die of malaria, about 423. So imagine how many will come from Nigeria, our childhood birth, our childhood deaths. So according to the 2024 World Malaria Report, Nigeria accounts for, as I said, it's 26%. Of recent, they even said 27. And in Lagos State alone, we have over 900,000 cases from the statistics we're able to get from the government facility. So what are the transmission? That's how it can be infected. The next slide will actually show the cycle. Just remember when I said the female, no, we can first go back to the first one, the previous slide. How can we get this malaria? The first one is through the mosquito, it's through blood transfusion and congenital transmission. That's mother-child. So that is why, along the line you said, that is why for women that are pregnant, they tell them to take sulfadoxine pyrimethamine during pregnancy. So that's why they're having recurrent symptoms of malaria. This will prevent the child from having it after they give birth to children, to their kids. So next slide, please. So how is it transmitted? When we look at now, it said the breeding site of the mosquito is around our houses. Around our houses starts from we store water. When we store water, do we cover it? We have to cover it. Mosquito actually thrive where the water is clean and stagnant. When I say clean, you just finish fetching water or a clean stream, but the water is stagnant. That is where mosquito thrive. So when we look at number one, the breeding site is our homes. All those empty cans that now something like yesterday now it rained. So there are cans, there are empty tires, there are tires, so many places where water is. Mosquito thrive well there. So the next thing is that, I said is the infected female Anopheles mosquito. So the female bites a person who has the malaria parasite in the body. After it bites that person, it will infect the person. The process actually starts from the mosquito itself, the male and the female. The male and the female, which is, I didn't want to bring it to your knowledge here, but I'll just summarize it for you. The male and the female meet. And when they meet, that is outside of the body. So when they meet, the male passes some things into the female mosquito. So that's why we say it is infected female mosquito. So it's the infected female mosquito that will now come and bite human being. And the whole malaria transmission starts inside the human body. So when it bites you, you feel something bites you and you are quiet about it. But the first thing it does is that it stays in your liver. When it stays in your liver, it keeps multiplying there. When it multiplies there, after some times, from there, you may start having malaria symptoms starts within 7 to 30 days when the mosquito has bitten you, depending on your immunity. So when it gets to your liver, you start feeling some symptoms, you treat malaria. Sometimes after we treat it from the liver, it goes to the blood circulation, but some still stays inside the liver. From your blood circulation, you now feel more of the headache, the nausea, I can't eat, I can't sleep. So at that point, we treat the malaria. But I said some still remains in the liver. So that is why you can have relapse. That's why after some time, you finish treating malaria, you still be having the malaria symptoms because some of them stays in the liver. So at least that's the summary for the matter. I hope I'm communicating. Hello?
Yes, you are. We can hear you clearly.
Okay. So what are the clinical features we have? The symptoms starting from the head, headache. But one of the main things that can be used as the symptoms for malaria is fever. It causes it causes fever. So from fever, then I'll go to the headache, fatigue, pain, you're feeling tired, back pain, chills, be shaking and sweating, you be coughing, enlarged liver. That is now when you go to the clinician, nausea and vomiting, loss of appetite, and so many other things. Next. So as I said before, as I said, the initial symptoms is 7 to 30 days after infection. Then we have the severe symptoms. I need to let you know that in malaria, there are two types. There's uncomplicated malaria, which is you're just having your chills, your fever, and your headache and your muscle pain. When the clinicians see you, they'll say you have an uncomplicated malaria. But when you now have symptoms like anemia is when your blood level is low compared to the normal. Jaundice, you're having yellow eyes, you can't breathe well, you're having so many other symptoms to the extent that the person will collapse, can be in coma. So that has become severe malaria. So the usual one we usually have is the uncomplicated malaria. So importance of early diagnosis and treatment also matters. So next slide, please. So what are the tests? How do we know we have malaria? There is not a standing law. There's a standing law from the national to every state now that you have to test before you treat. Because we want to avoid malaria or the resistance of the anti-malaria tablets. There are some resistance in some other African countries. It won't be good for Nigerians to have such. So that's why there's a standing order. Testing is done before any form of treatment. So the MRDT, you see it as the Malaria Rapid Diagnostic Test Kit, and we use the microscope examination, which uses the blood smear. So the first one is the Malaria Rapid Diagnostic Test, which we will see them using in the lab. It's very, very accurate. So when you see negative results, don't say because you're having a headache, it's malaria, then this thing is not working. It is very, 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 very accurate, except if otherwise. At least it's 99% accurate. Then the other one is the microscope, which we have to be sure that the person looking at our blood film in the microscope knows how to read it. There are so many medical lab scientists that can't read, but there are some people, especially if the government has even put them through how to read the microscope. So most people that are reading it for us are saying plus, 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 minus. Most of them don't know how to read the film under the microscope. And when you are reporting in the microscope, now it's not scanty or plus, plus. There's a way you record. You indicate the type of mosquito, the parasite, and indicates the volume. That's how the right person knows how to read out the results, and that's what the person will write. Not plus plus, canty, no, no, no. So treatment now, artemisinin, that's artemisinin-based combination. That's our ATC, which we all know. So examples are the artemether lumefantrine, artesunate amodiaquine, dihydro artemisinin peperaquine, which they have different trade name, which I'm not very sure about, and so many other new type of anti-malaria. Then SP is the topazone pyrimethamine, which some of us has known commercially as Fancida. It is usually given to pregnant women. Is part of what we use as preventive measure, so that she won't come down more with malaria and affect the child by the time the child is born. Even before the child, it can even cause stillbirth, the child's death inside the woman's stomach, inside the woman's womb. So all these things, so they are all important. So that's why you see most of the time SP, they're not given to just the normal person. It's not majorly the pregnant women. Next slide. What are the ways we can prevent this? Prevention. Insecticide treated nets, which we all know about. Our net is not for decoration. It's not meant to use as a fishing net or as a sponge. They are meant to hang it. It has been shown it is reliable to prevent malaria, the net. Then indoor residual spraying. We spray our inside, close the door. I need to let you know that mosquito usually bites from in the evening, from like 4 or 5 till early in the morning. That's when they usually function. During the daytime, they don't really function well. So that's where then personal protection. You wear long sleeve or use repellent. Chemo prevention, something like using the sulfadoxine pyramid, for pregnant women. The malaria vaccines, which is now available, but it's only meant for 1 to 5 months old children, nothing yet for adults. And of course, remove stagnant water. Control is now, we have to educate our people, which government is now trying to do more. You have to educate them so that when you know something, you know how to prevent it or how to work it out. Environmental control, clear the bush. And it's not for me to tell you that the malaria prevalence in Lagos State has actually reduced due to urbanization. All those stagnant places where there are marshy waters and everything, they are building houses there. So the malaria causing mosquito itself has really reduced. The prevalence, we still had the survey, not last year or previous year, which is apparently another one. The prevalence in Lagos State has really, really reduced drastically. And we should make sure we treat all infected person. Anybody that is negative or positive should be treated. Thank you very much. Thank you.
Thank you very much, Dr. Kehinde Adeniran. That was a very fantastic presentation. Thank you so much for opening our eyes to the details about malaria. There's something you said that stood out to me. You mentioned that if you know something, if you're educated about something, then you know how to control it. And that's the essence of this particular program we're having on Kenix Care Conversations, supported by Lagos State Ministry of Health, with Dr. Kehinde with us today. You made a lot of points, and I was noting, and at a point I didn't even know where to write again. And I'm sure our attendees have also picked one or two things, from your presentation. So Dr. Kehinde talked to us about, the life cycle of malaria, how it goes from, the stagnant water to biting an infected person, and then going on to bite another person, and like that, malaria is transmitted. She also mentioned about, ensuring that if we're going for a lab test for microscopy, we should ensure that the lab scientist is actually qualified and is able to do the correct thing. Otherwise, we'll be ending up with the plus, 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 and we don't just want random plus, plus. And then medications that she mentioned that she'll be taking, a lot of combinations, artemether, lumefantrine, and dihydroartemisinin, piperaquine, and the rest of them. Then she also talked about the fact that we have to protect ourselves, personal protection, especially in the evenings. It's important to protect ourselves because that's when the mosquitoes bite. And of course, continuous education, like we're having with Kenix Care Conversations. We're going to take all questions at the end of the program. So please bear with us while I just run through our own part. So we've been able to learn that malaria is a living health concern in Nigeria, and it affects a lot of us. So for us at Kenix Pharmacy, we are dedicated to ensuring fast, accurate, and effective treatment of malaria. Dr. Kehinde mentioned malaria rapid diagnostic tests, and this helps us to ensure there is proper diagnosis. And the medications which she mentioned, the artemether, lumefantrine, we have them in brands like Lonart, we have them in brands like Tametafort, we have them in brands like Amatem soft gel, we have them in brands like Ateget. There are a lot of them. Dihydroartemisinin, piperaquine, we have them in brands like Atepic. So all these products are available at Kenix Pharmacy at the right quality and the right storage conditions. And you can trust that we source from direct companies to ensure that what you buy is what you actually deserve as a patient for effective treatment. And of course, we offer you patient support to ensure that you're taking the correct dosing. For instance, for artemether, lumefantrine, there's an 8-hour dosing time between the first and the second dose. We communicate that to you effectively to ensure that you fully understand how to take your dose and you're taking it to get the full benefit from it. And of course, it comes with counseling and guidance. And of course, if it's a severe situation, we'll refer you to the right hospital where you can get extra care. So your health is basically our priority. Okay. Medications like fancy that, like doctor mentioned, are available. It's currently called Swida. It's currently called Swida and is available. And mosquito treated nets as well. And we are dedicated to ensuring we continue to educate because, like she mentioned in her presentation, once you know something, you'll be able to control it. And that's why we will continue to promote health education through Kenix Care Conversations. And you can trust that our brand offers you high quality and committed to your well-being. So let's fight malaria together. We want you to visit any Kenix Pharmacy around you. We have one at 78 Community Road, Agor Palace Way. We have another one at 145 Agor Palace Way. And our brand new baby across the bridge, Omolaba, yes, Omoloba Baka Bokno is open now. So if you live around that area, please be sure that you're going to get high quality medications and exceptional pharmaceutical service from our team members. So you have dedicated pharmacists, intern pharmacists, and of course, wonderful pharmacy assistants to attend to you anytime you visit any of the Kenix Pharmacy. So I want to appreciate you once again for joining, and the floor is open now for questions. So thank you very much, Kenix Pharmacy, and thank you very much, Dr. Adeniran from Lagos State Ministry of Health. So just before we move on to the questions, we'll invite Dr. Chinazom Eya to give us a summary of both presentations. She specializes in drug delivery of malaria, anti-malaria medication. So welcome, Dr. Azom. Hi. Dr. Azom, are you there? You there? Okay, while we wait for her, please go ahead. If you have questions, you can note it in the chat box, or you can easily raise your hand and ask your questions directly. We are here.
Yes, I'm here.
Oh, okay, great. Please go ahead.
Okay. Good afternoon, everybody. I believe you can all hear me. Yes, my name is Dr. Chinazom Abu. I'm in the Department of Pharmaceutics, University of Nigeria, Nsukka. Hope you can hear me.
We can hear you clearly.
Hello.
Please go ahead. We can hear you.
Can you hear me?
We can hear you.
Okay.
Yes, please go ahead.
Okay, I'm a researcher and also a lecturer, and my specific research area is on the, and my specific research area is on the design of novel drug delivery systems that are in nano sizes for the treatment of malaria. So that's what we do here. I'd like by starting with one of the lines used by the presenter, the first presenter in the invite of this conversation. He says that the fight against malaria involves you and I. Most times that is something the average Nigerian doesn't have in mind. The average Nigerian feels that malaria, if he's having malaria, he has the right to treat it the way he wants to, take drugs. If he takes the first dose and the second dose and he feels better, he stops. But the truth is that those are the things, that the factors that cause resistance and makes resistance to spread. Right now, the world is talking about elimination of malaria and the eradication of malaria. Elimination of malaria is where a country does not have one case of malaria. And so many countries in the world have achieved that. So many countries, or more than 100 countries in the world have achieved that.
Hello, can you hear us? Hello, don't touching us on. Oh, okay.
Can you hear me?
Yes, we can hear you now.
Okay.
Lost
Where
your
did
audio.
you stop hearing me?
Well, we're talking about resistant malaria.
Okay, so I was saying that many times Nigerians we treat malaria as if it's not a social and a public health concern. So when a person takes a dose of a drug and he feels better, he stops. But that is what causes resistance. And right now, WHO is talking about elimination and eradication of malaria. Elimination is where a specific region, a specific country doesn't have malaria, one case of malaria, while eradication is where WHO is targeting, where the entire world doesn't have one case of malaria. So that is where, as a country, we should be heading. But then we are still having more cases of malaria. We are still having the highest burden of the disease in the world. And resistance is a very real problem. Resistance is a real problem where I know many of us here have experienced it, where you take malaria drugs and you complete treatment and it's like you did not do anything. You go ahead to take an injection and then you may even be admitted in the hospital, and by the time you leave, you are still feeling as if you are still having malaria. That is because of resistance. So there are many causes of resistance, and one of them is caused by patients. The other is caused by the patient, by the patient, and the other is caused by the drug that the patient takes. So in the case of the patients that, like I've mentioned, when you don't complete your medication, you are at high risk of developing the resistant strain of Plasmodium. And once another mosquito comes and bites you and goes to infect another person, you have sprayed that resistant strain of the Plasmodium to another person. And that is how resistance spreads. And the other cause of concern, or what causes resistance, is when you are taking a drug, you think it's written on it artemether lumefantrine, it's written on it artesunate mefloquine, and you think it is those things that are written on it, when in the real case, the drug is either substandard or is fake. So that is where going to the right pharmacy is very important. And that is where Kenix Pharmacy has a role to play. We are sure that when you get to Kenix Pharmacies, you are going to get the quality of drug that will be, when you take it, you are sure that what it contains is what is written on it. I'll give you a particular scenario. There was a work that I did during my master's that involved my dissolving a drug in what looked like the GIT environment, the gastrointestinal environment, and then finding out the quantity of the drug that was released into that medium. And this, I used one of the brands, one of the artemether lumefantrine that we all use for treating malaria. And it sat there in this fluid, in the simulated gastric fluid. It sat there for 8 hours without dissolving, not to talk of disintegrating. It was just as solid as when I put it. What is the implication of such a thing? What it means is that if you as a patient takes this drug, it will just pass through your GIT and you defecate it out. So and that is where going to get the right drug from the right source comes in. So it's very important that as individual you take hold of your health and make sure that you go to the right place to get the right drug. So I'll be here to take any more questions that you will have. Thank you.
Wow, thank you very much, Dr. Azom. There are so many questions. There are so many questions. I hope Dr. Kehinde is still on the call. Thank you very much. So let's just dive into the questions. Isaiah Wolabi, please ask your
Yes.
question.
Good morning. Good morning.
Morning. Thank you for joining.
Thank you, Dr. Adeniro. What a very breathtaking, very precise presentation. Thank you so very much. I've learned a lot. So my name is Pharmacist Isaiah. I'm joining from Olan Pharmacy, Surulere. Thank you, Pharmacist Ayo for this, for putting this together. So I have a few questions here. I mean, I took note of about 5 questions actually during the presentation. Okay. So, Dr. Adeniro, you emphasized on the RDT, and in particular, you said it's very accurate. And then I have a concern about that. Okay. So I'll be speaking from a very practical point of view because, of course, I always say that in Nigerian settings, I stand to be corrected, but I do know that the pharmacy is the first point of call for the populace. Can you hear me, please?
Yes, we can.
Hello?
Yes, we
Yeah.
can.
All right.
Go ahead.
Yeah, so I was trying to establish the role of pharmacists, that the pharmacists, they are the point of call for the populace. And so when they feel funny, they're not feeling 100% in their body, the first point of place they want to come to as a healthcare place is the pharmacy. So most of the time, it is what the pharmacist could not undo, then that is taken to the hospitals. So I've seen cases of people that come to the pharmacy and they present with a typical case of malaria, empirically diagnosing it anyway, empirically. They present with a typical case, the fever, the persistent fever, the headache, the joint pain, the tiredness, the fatigue, that you would strongly suspect that this is malaria. But then, 3 years ago, I was working in a pharmacy then, and then I decided to use the RDT. I won't mention the brand anyway. So I used the RDT, but I thought, okay, let's do the test before I go ahead with the treatment. To my surprise, I mean, after checking with the RDT, it was negative. Okay? But here is the patient presenting with the typical symptoms of malaria. Very typical. It was so negative on the RDT. I decided to ignore that result because it's not the first time such is happening. All right? I went ahead to treat malaria. That was 3 years ago. I treated malaria. Lo and behold, in 2 days' time, this person was back on his feet. That is not the only scenario where I will not express 100% confidence in RDT. Maybe the microscopic test in the lab would suffice. But then last year again, the same thing happened. And so, following my very negative experience about RDT, I lost confidence in RDT. I was opportune to speak. Hello?
Yes, can you hear me?
Clearly, I can hear you.
Yes, sorry. Could you please ask specific questions so that more people will be able to ask before our time runs out?
Okay, but I think the first speaker really took our time to ask questions because I have 5 questions actually. What do we do?
Yes. So let's look at the questions.
It's all right then. So the question is that how confident are you with the RDT test? That's question 1. So in the interest of time, let me summarize my questions. So that's question 1. Question 2, it's that you are saying that it is until you are properly diagnosed with malaria that you should initiate treatment. But we have had cases where people that are in malaria endemic area like Nigeria, if they are going to a non-endemic area, let's say Europe, they are advised to treat malaria, even if they are not down with symptoms. I've seen that clearly. I've served some prescriptions for that purpose. So what do you have to say about that? People in malaria endemic area like Nigeria, they are traveling to Europe, to London, and then they need to just, they are advised to treat malaria before going to a non-endemic area. What do you say about that? My next question, can I still proceed, please? Hello?
Yes,
Hello?
yes,
All
yes,
right,
we've had
so
two
I have
questions.
asked 2 questions right now. So the third questioner is the IPT, which is the one given to the SWIDA, the combination given to pregnant women to prevent transmission of malaria to the unborn child. So I want to ask, because I have seen in my pharmacy pregnant women who are in their second trimester, and I would ask them. I even asked one of recent that, okay, in your antenatal clinic, were you giving this drug to take at any point in time? And she said she has never been given that medicine to take at any point in time. So I want to ask, do you think it is advisable for us to initiate IPT at the pharmacy level? And at what trimester do you think we can initiate it? At what point of each trimester can we initiate IPT in pregnancy at the pharmacy level? Okay. I think that is fine. So let me summarize it to those 3 questions in the interest of time. All right. Thank you very much.
Okay, thank you very much. Dr. Kehinde.
Yes. Can I start?
Yes,
Okay.
please.
Okay, let me start with number 3. For number 3, I will advise you to initiate IPT. Thank you for the questions, first of all. IPT is usually initiated after quickening of a pregnant woman. And even in some hospitals, before they start it, they make sure they ask them, they make sure they check the child, do scan, and be sure so that when the woman starts taking the medicine, she won't say because I took this medicine for medical legal reasons. She won't say because I took this medicine, my baby is not moving again. Usually initiated after quickening. When they come to the pharmacy, if they are not sure of their quickening and you start the medication, in case she has other issues, they're going to be in trouble. She just imagine what you gave her is in course. So it's better let them go to the hospital. They'll be sure after quickening, then they start the medication every month too. Then the second question, he said those in UK coming to Nigeria, yes, they tell them to treat malaria, to use the full treatment. Coming to an endemic area, they don't encourage them to use SP. It's better because if it's a preventive measure for a person that has been in UK coming to Nigeria, your blood is as free as no mosquito inside. So for the malaria, for the mosquito to bite you, the complications will be very serious. So because they want to prevent that, that's why they tell them the full dose of the anti-malaria medication should be taken. Then confidence in MRDT, yes, I can. At least I've gone to some specific World Health Organization countries, China, India, and so many countries, concerning this MRDT. The MRDT we are purchasing in Nigeria, at least government owned, is the registered one from World Health Organizations. They have done the research, they have used them, and I have seen the results. What is happening is that sometimes our storage system, where we store them, when the heat is too much, it spoils the thing. So it can give false positive or false negative results. That's why they always encourage the storage system and the type that is being sold. If it's the recognized one, which I have gone, as I said, I've gone to specialized center, WHO specialized center, where they certify the MRDT to be sent to different countries. Yes, they are working. I can guarantee you that. And it's not all these symptoms that every time it is malaria. I've actually had someone, what you said, this is not the first time I've been hearing that question. I've had someone that was treating malaria, and I told the person, why don't you go for further tests? And further tests showed he had many other things. Because one way or the other, psychologically in Nigeria, we believe I'm having headache, I have malaria. Psychologically, when we use it, we get better. But sincerely, the prevalence in malaria in Lagos State law, even some parts, Kwara and some other places, it has really reduced. Anopheles mosquito in Lagos has reduced. There are other types, but Anopheles are really reduced. So that's what I'm very sure about it. Thank you.
Thank you very much, Dr. Deniran. I like that you emphasized on appropriate storage conditions for RDT, and even the products that are recommended to the patients or that are dispensed, stored in the right condition, the right temperature to avoid getting the wrong results. Okay, so we have another question from Uwemedimo. He's asking, what's the difference between poorly treated malaria, resistant malaria, and recrudescence?
Poorly
Poorly
You said
treated malaria,
poorly treated malaria.
resistant malaria, and recrudescence.
Hello?
Can you hear me?
Hello?
Yes, we can hear you.
I'm alive.
Hello, Dr. Daniel. Hello, doctor, can you hear us? Dr. Azum, I hope you are there as well.
Yes,
Hello?
I am.
Sorry,
Oh.
I just realized. Let me check.
Hello?
Hello, we
Hello?
can hear you.
Can you hear
Okay.
me?
Yes, I can.
Okay. So I think it was my internet.
Okay. So this person wants to know the difference between poorly treated malaria, resistant malaria, and recrudescence.
Can I take it?
Yes, please go ahead.
Okay.
Yes,
Well,
yes.
poorly treated malaria is a malaria that did not receive the appropriate drug at the right dosage. For example, you are having, severe malaria already, and you are treating it like uncomplicated malaria, because for severe malaria, you have to use IV or parenteral artesunate or quinine. Then if you go and start taking tablets and it's already severe, you are treating it poorly. And while resistant malaria is a malaria that was also, because of poor treatment, the parasite develops resistance to that strain of Plasmodium, so that the drug that was supposed to be effective is no longer effective. So even though artemether lumefantrine, artesunate, and the rest are still working for another person, but because the strain of Plasmodium you have in you is the resistant strain, you take those drugs that are supposed to be working and they don't work for you. So that is resistance. Recrudescence occurs because of the parasite in the liver. So like when Dr. Deniron was presenting, she mentioned that there are some malaria that is still in the liver. After treatment, it comes back. So recrudescence happens because of that relapse due to the maturation and release of the parasite in the liver coming into the blood cell. So that is the difference between poorly treated malaria, resistance, and recrudescence. Thank you.
Thank you very much, Dr. Chinazum. Thank you very much. This question was well answered. Well answered. It's very important to appropriately treat to avoid development of resistant malaria and, of course, recrudescence at the end of the day. So thank you so much. All right, the next question says, any preventive treatment for those susceptible to malaria attacks? So I think,
Can I? Okay.
go ahead.
Huh?
Any preventive treatment for those susceptible to malaria attacks? I think it was mentioned in the presentation. Yes, please go ahead.
Yes, there are preventive treatments. It's just like the woman, Dr. Adeniran presented, pregnant women are very susceptible to malaria. So that is why they are treated with SP, sulfadoxine pyrimethamine.
Yeah.
So even individuals, even though you are not pregnant and you feel that something, maybe your immune system is down, you are immunocompromised, you can take SP. However, the better thing would be to prevent your immune being compromised, and one of them is taking immune boosters. And I believe in Kenix, you have immune boosters that can help a person improve one's immunity so that you will not easily come down with malaria. And there's this part of malaria treatment we don't usually talk about, which is the second line treatment for malaria. So apart from SCTs and the popular drugs are the first line of treatment, but you can still go for the other second line treatment, which is taking quinine with tetracycline and doxycycline or clindamycin. So or taking artesunate with doxycycline or clindamycin or tetracycline. So in summary, what I'm saying is you can take SP if you are suspecting malaria. You can also do things that will boost your immunity, eating well, taking immune boosters, resting, and then you can also go ahead to go for other non-popular medications like quinine, because you see, quinine is a very powerful drug, even though you have to be careful while taking it. But then the good thing about it is that resistance to it is not as rampant as it is as resistance to ACTs. Thank you.
Thank you very much, Dr. Chinazom. So yes, at Kenix Pharmacy, we have the sulfadoxine pyrimethamine, that's SWIDA, for preventive measures in pregnant women. Of course, based on the presentation, you heard when Dr. Adeniran mentioned that malaria can be transmitted from the mother to the child. So it's essential that when the hospital...
I'm so sorry. My network, I don't know what happened.
Oh, okay. Welcome back, Dr. Adeniran. It's important that we protect the pregnant women using the right medications that are prescribed at the hospitals. And then for us, for using immune boosters, like Dr. Chinazom mentioned, at Kenix Pharmacy, we have a wide range of multivitamins that Hello, can you hear me? Yes. Okay. I got locked that a bit. Apologies for that. So I was saying that Kenix Pharmacy offers wide range of multivitamins that you can use to protect yourself from coming down with malaria, as advised by Dr. Chinazom. Okay, let's go back to the next question. Okay, I think this one has been answered. Please, in the case of testing a patient with malaria, in the case of testing a patient with malaria rapid test kit and it shows negative, but the patient has every symptoms of malaria, is it still wise to treat the patient with malaria? So just like Dr. Adeniran mentioned, once you use the right rapid diagnosis test kit for malaria, which has been stored in the right storage conditions, she has 99.9% confidence in the test results. So if it's still showing negative, then further test.
My network. Sorry. Sorry, it was my network.
Sorry about that. Welcome back. Yes, I was just repeating your answer to this question because someone else typed it in the chat box. Yeah, so further investigation should be done to ensure that it's not just malaria, even though the person is presenting with malaria-like symptoms. Yes, if further investigation is done, you'll be able to see if the person needs to treat for something else, right? That's the essence of doing test investigation or investigations in a reputable laboratory. All right. Okay. So let's see if there's another question on the chat. If you have a question, you can easily raise your hand. Is there any other question on the chat box? If you have any other question, please raise your hand or drop it on the chat box and feel free to ask. This is an opportunity to really ask any question you have around malaria. Like I mentioned, between January and now, you or someone you know must have had malaria. This is an opportunity given to us by Kenix Pharmacy to ask questions and learn more. Kenix Care Conversations is dedicated to educating, caring, and empowering you with the right knowledge so that you'll be able to improve the quality of your life and, in this particular episode, break the malaria cycle. All right. So I'm not seeing any other question on the chat box. Is anybody raising their hand? Okay. So I think everyone has been taken care of. Okay, Dr. Adeniran, we have another question. And Dr. Chinazon, we have someone raising their hand. So please pay attention. Okay. Ifoma, please unmute.
Hello, good morning, everyone. I'm Ifoma Ude. Mine is more like a comment. I want to really appreciate the organizers of this talk. It has really been enjoyable and quite exciting. I really learned a lot. And just to chip in a bit about ensuring that if we're receiving the right medication, it should be at the right storage pattern. Currently, they are phasing off suspension anti-malaria, the artemether lumefantrine that would have to come in suspension because that molecule is not stable in that form. So would prefer the dispersible tablets, especially for children. So I just wanted to chip that in. I don't know if it was mentioned because I joined a bit late. Apologies for that. But all the same, well done. It has really been an enjoyable presentation from all the presenters. Thank you.
Oh, thank you very much. Thank you very much. Yes, you mentioned about preference of dispersible anti-malaria tablets to suspensions. Yes, at Kenix Pharmacy, we have a number of dispersible tablets like Coatem, like Laritin, Locmal, and then we also have the one that comes in powder, camosinate, comes in individual sachets of powder. So yes, our patients will be able to get those if they are prescribed or recommended. So thank you very much for that contribution. It's really essential to be sure that the patients are getting exactly what they need to for effective treatment. All right, so we have a question here. Please, what's malaria plus plus? What does it mean? Okay. All right, Dr. Deniron. I think she was one that mentioned the malaria plus plus. Is she on the call? Dr. Deniron on the call. Okay. Like our network is still. So basically, the malaria plus plus is the result. Yes, the result you get. Let me see. She's not on the call. Okay, Dr. Chinazam, do you want to give it a go? Okay, Fama.
Don't worry, you can go ahead. You already.
Okay, Dr. Fama, go ahead.
Okay, thank you. Sorry. So it's actually the way we report the malaria test, malaria microscopy from the lab, which is also currently not recommended because now we want to know what the parasite count is. What is the parasite density? So just malaria plus plus is a bit subjective. But what we prefer now is for you to give us what the count is in parasites per microliter. So it's just looking at the malaria parasites per field under the microscope. The scientists would then record 1 plus, 2 pluses, depending on the number they are seeing per field under the microscope. But that, as the presenter rightly mentioned, is also being phased out. Give us what the parasite count is in density, so that as you're treating the patient, you can also monitor response to treatment, because ideally the count should decline once patient receives adequate treatment.
Okay, thank you very much. So you mentioned that the plus plus, 1 plus, 2 plus is now being phased out. It's no longer supported. So we're going more for the parasite density. Density count. It's brand new information that you get only on Kenix Care Conversations. So when your lab scientist is giving you plus plus plus, you can now speak confidently that how about the parasite density, right? So the